So, um, uh, we're having a lot of conversations today about health services and access to health services. And I just want to emphasize that although and it is a very, very important conversation we're having, but to keep in mind that the vast majority of the health of individuals and of communities is from things outside of health services and access to health services, those social determinants of health, and how we experience our everyday lives from pre-birth, all the way to the end of our lives. And so I'm going to highlight some of those challenges that we're facing here with that, but also some of the really important strengths of this community. So let me see if this works. So already mentioned, we're talking about where you live, population of about 17,000, and of course the majority of the population is here on Salt Spring Island, but we do have the other smaller islands as well. And one of the things that was mentioned was around the population growth and change. And so that is something that is affecting Salt Spring Island and the Gulf Islands now, and it is going to continue to be something that is in transition over the next years. So, our migration levels here are not as high as some parts of the island, but still in that positive direction. So we're seeing continuous growth. And like Kathy already mentioned, one of the groups that we know for sure is going to be growing in proportion in absolute numbers is our elderly population, and particularly for the Southern Gulf Islands, that population over 75 years is going to increase dramatically over the next 10 years. But the other thing you'll notice here is that the younger population, particularly children and younger adults, is actually going to be staying pretty much flat. And so that has implications, of course, for workforce and the ability to provide services, but also the challenge of having kind of the right mix of services and opportunities for people at all ages and stages of their lives. And that's just to kind of give you a picture of what that change will look like. So you can see that red box is the one that's going to be growing the most quickly in terms of the 75-year-olds. So that's kind of the background context of our demographic changes. And then what we're seeing right now in terms of some of the more important social determinants of health challenges, this is not, I know from the conversations I heard this morning, housing is a huge priority and concern across the country, across the province, and then particularly for this region. And for the Southern Gulf Islands, the statistic from 2021 was that on average, households are spending 40% of their income on housing. This is for renters. And just as a kind of snapshot of the cost, this is from a Victoria stat. I'm sure it's fairly similar in Salt Spring Island. 2-bedroom condo is over $2,000 a month. And of course, the benchmark that we look for is that households are not paying more than 30% of their income, because we know if they are having to pay more than that, then they are having to, by necessity, make sacrifices in the spending that they can do for their other household needs. Unemployment, of course, is a very important social determinant of health, and in that regard, Salt Spring Island and the Gulf Islands does fairly well in terms of our overall unemployment rate. So I think the bigger challenge right now that people are facing is actually the wage that they're earning. So it's maybe not as hard to find a job, but to actually be earning the amount of money to keep up with the cost of living increases is of course a huge stressor. And what that results in is things like food insecurity. And so we know that this statistic came from a survey that was done during the pandemic in 2021. Almost 9% of people on that survey recorded that they have difficulties meeting their food needs to be able to afford healthy and nutritious food. And that was 9% in 2021, and I have no doubt that that's actually increased given inflation and rising food costs. And this is, across the board. We know many of the efforts I've seen in community here in Salt Spring Island have been trying to address some of those food security issues. So really want to encourage keeping that in mind and how it's affecting, households everywhere. Another really important measure that we look at is our early childhood indicators of health and well-being. And that's important, obviously, not only just for the children and their families themselves, but because we know that the more supported and healthy kids can be getting that beginning stages of life, we know that that impacts their likelihood of being healthy and well throughout their whole life trajectory. So the more that we can support families and children to have a good start in life, then we kind of reap that benefit over the years as they grow older. And one of the measures that we look at closely is what's called the Early Development Instrument. This is a survey that has been started back in 2005, and it measures children at the kindergarten level in terms of a number of measures of their social and emotional development as well as their academic development. And the orange bars here are for the Southern Gulf Islands. So you can see back in 2005, 2007, it was about 20% of children that were identified as having at least one vulnerability in that area, and it's just steadily increased into the most recent wave, which was over a third of children are being identified as having some vulnerabilities. So that just really speaks to the risk of our children having a more difficult time, meeting their health needs and developmental needs. And this other one is speaking more around adolescence. So this is a McCreary survey that is done in schools in the adolescent age. This data is from 2018, and there was just one that was completed this past school year. So we don't have that information yet, but we'll have similar data available. And this looked at self-reported problems with mental health or emotional health and long-term chronic conditions or learning disabilities. So this is by school district. So school district 64 is the one that includes the Gulf Islands, and we have, again, a very high percentage of the youth are reporting mental health difficulties. And then, it's a picture that we can see in many, many different parts of the island, but it is concerning when we're seeing that level reported. And unfortunately, I think we are going to anticipate that we're going to see at least that high level, if not higher, with the next go-round of this survey. So the mental health of young people, I think actually we'll go on to the next because it'll talk a bit about substance use. And certainly I heard that in the conversations today about how much of a concern and an issue that is. And we know with adults struggling with substance use issues, mental health issues, a very, very high percentage of those people actually did have difficulties in childhood, faced adverse events in their childhood. And so as much as we can prevent those, support people through those events, the more likely we are to be able to prevent some of that adult mental health and substance use issues. So this is just showing some of the top causes of death for island health in 2022. And you can see in the top graphs, that's by age group, and that orange or the orangey yellow bar is our cause of death from the illicit drug overdose crisis. And so you can see it's among the top causes of death of our people under 60 years of age. And unfortunately, it has not been getting better over the years. What that means for Southern Gulf Islands, we do have a lower rate of reported illicit drug toxicity deaths compared to the island health average, but that still means 4 people on average a year are dying on the Gulf Islands from drug overdoses. And again, tragedy, this is preventable, and our teams are working hard to address this, but it is a very difficult, wicked problem right now that we're looking at. Also talking about substance use, I think another one that maybe we don't talk about as much though, but is very, very important and from a population health level, is alcohol consumption. And this graph on the left here is our consumption patterns. And so you can see that orange line is the Southern Gulf Islands. So we are consuming more alcohol on a per capita basis than the BC average. So this is for people 15 years and older. And what that translates to is, I've written it down, It's basically averaging about 2.3 drinks a day for adults over 15, and what is that? If you multiply it, 16 drinks a week. And so if you are thinking, oh, I'm not someone who consumes that much, then you realize that somebody else is making up that gap for you. And of course, we know alcohol, chronic use of alcohol has many impacts in terms of health, chronic health diseases, cancers, dementia, hospitalizations. It causes a direct burden on our hospitals, and of course there are alcohol-related deaths. So again, work needs to be done at a societal level to try to decrease the level of consumption and reduce some of those harms. And it's a tricky one because there's a lot of societal forces as well that have been promoting alcohol consumption over the years. So that's a lot of challenges. I do want to speak to some of the strengths and where I feel like this community in particular does very well and needs to help. We need to help all of us in partnership to promote. And that is around the community resiliency and some of the ways that how that protective that is. So this is looking at mental health and well-being, and this is again measured sort of midway through the pandemic in 2021, and it asked people whether or not they felt they had poor mental health, stress, and weaker community belonging. And actually, the Gulf Islands did very well in that people were actually feeling better about that than at the beginning of the pandemic. And I think this really speaks to the resiliency of the local communities, where people felt supported, they felt like they were in community, they were helping each other through this time. And to me, that's just a reflection of the capacity that's in this community to support each other. And for me, that also emphasizes the need that we really, really need to support this going forward for everybody from all ages. We saw the youth are vulnerable here, and then all the way up to the seniors and needing to feel that belonging, the ability to contribute to society, and feeling safe and included. So I think the work that I see here, and we'll probably hear more about from David in terms of the health networks, but also all the other sectors that support people, is something that you need to remember. Remember that it's improving everyone's health, individuals' health, and that you've demonstrated you have that capacity to do that. So that is all. Thank you.